Reale Hospital and Clinics cares for you.
Welcome to this short presentation about the orthopedic services that we offer at Reale group of hospitals, the main hospital being based in Eldoret, Kenya. My name is Dr. Anthony Njoroge. I'm a consultant orthopedic and trauma surgeon, specializing in limb reconstruction, especially of joints, and also complex traumas, that is complex fractures. I'm also the head of orthopedic services at Reale group of hospitals, and I work with a team of orthopedic surgeons of varied scopes. We have an arthroscopic surgeons within our midst. We have a specialist hand surgeon within our midst. So we have a big team of about 5 orthopedic surgeons. In orthopedics service that we offer at Reale, we look at the whole scope of orthopedics, which we can broadly categorize into trauma and non-trauma. So we are able to take care of all trauma conditions, from least complex of fractures to the most complex of fractures, including pelvic fracture surgeries. We are able to perform them here at Reale Hospital, having the technical expertise amongst our team and also the technical support for us to perform those procedures. But amongst the non-traumatic conditions that we deal with at Reale Hospital on a day-to-day basis is the problem of arthritis. And most people ask, what is arthritis? Because it is one of the most common conditions affecting the aging population. Arthritis, to use a general term, is a disease of the joints, because the word arthro means joint, and the arthritis therefore means an inflammatory condition of the joint. However, not all arthritic conditions are inflammatory, and I want to speak specifically about one condition called osteoarthritis. Osteoarthritis is the most common joint problem in the aging population, and it results from a degenerative wear of a joint. In the basic anatomy of a joint, for most people, I'm sure they have seen an open joint, whether human or otherwise. Each bone that is forming a joint is covered by a very smooth tissue known as cartilage. Over the years, this smooth white material that makes the joint so smooth is worn out progressively. It may wear faster in some people than others, because of the nature of work, because of factors like weight, and also genetics. But also, it may be speeded up by previous conditions of the joint, like injuries to the joint, or inborn problems, or congenital problems, or developmental problems of such joints. So when one develops arthritis, how would they therefore know that they have osteoarthritis? The main sign and symptom is pain. Most patients, or all patients, will present with varying degrees of pain in the affected joint. And arthritis may affect either a single joint or multiple joints. And the most common affected joints are the weight-bearing joints, the large joints of the lower limbs, that is the hip joint and the knee joint. But it can affect all other joints. So a patient will typically complain of pain, they complain of swelling of the affected joint, and they will also complain of noises and creaking sounds emanating from that joint when they move it. They will also complain of limited motion of that joint. And as the disease progresses to what we call end-stage arthritis, they will notice a progressive deformity of that joint. To give an example, somebody who has normal looking lower limbs and knees suddenly realizes that their knees are bowing, or they're developing a knock knee in old age. This is a very common situation or complaint for end-stage osteoarthritis. And this generally negatively affects the quality of life for these patients, and they are typically in chronic pain and unable to perform effectively their activities of daily living. So once a patient presents with this condition, the typical diagnostic test that is done for osteoarthritis is a varying number of x-rays for the affected joint. The doctor will typically order the x-ray for that joint, from which he or she may order one view or many views, or with the patient either standing or weight bearing or non-weight bearing x-rays. And the doctor will look at the x-ray, and the x-ray will give will show characteristic x-ray findings of osteoarthritis, including loss of joint space, including what we call sclerosis of the bone at the articular surface, under the articular surface. The doctor will see many other x-ray findings characterizing osteoarthritis. They may also be able to see the ensuing deformity that is caused by the advanced osteoarthritis. Once a patient is diagnosed with osteoarthritis, the doctor will have a number of options to choose from, depending on many factors. And the main factor is the stage at which the disease has been diagnosed, and also the patient factors, including their age and the state of health. These are some of the considerations that the doctor is going to put on the table to be able to make a decision on how they are going to treat you as the patient.